Welcome to the Learn True Health podcast. I'm your host, Ashley James. This is episode 2.
A common saying amongst most of the people I know where you're listening for the whisper so you don't get the cosmic 2x4. Where life will set you up to succeed. You will get warning signs. Your body doesn't just shut down and fail on you. You get a headache, you have sniffles, you have GI upset. Something happens low down on the radar that gives you a warning sign that lets you know, hey, I got to pay attention here. And if I could figure that out for other people in their life with medicine, it seemed ridiculous to not listen to that in the greater aspect of my life as it was showing up.
Today I have a very special guest to introduce, but first, let me tell you a bit about her. Dr. Heidi Semanie went through a very difficult time in her life. And, I know that all of you could relate to this on some level because everyone has gone through some kind of hardship at some point. And this in particular blew me away. She was part of the Gulf disaster relief team for Hurricane Katrina. She basically lived in a war zone for 3 months. And through that, I'm surprised she's not suffering from post-traumatic stress, but she went through something horrific and the whole time was there to help others get out of that situation because she was working as a paramedic. And during her experience, she not only wanted to help people, but there was something in that motivated her to become a naturopathic physician. And so if you've ever had a hard time in your life or something's traumatized you, really listen to her words because she shares how she was able to come out of the other side and then be able to survive medical school, naturopathic medical school, and then be able to survive her residency and then be able to become an amazing doctor. Being able to do that in the face of having been through something extremely traumatic. A lot of people, when they go through something traumatic, they get stuck in life, and she didn't. So she has some words of wisdom to impart on you, and I'm really excited to bring her to you so that you can learn from her. I know I have. Dr. Heidi Semanie, thank you so much for being on the show. I'm really excited to talk to you today.
Thank you for having me.
Awesome. Well, let's get started. So, Dr. Heidi was born and raised in Massachusetts. She holds a Bachelor of Science from the University of Vermont in Biological Sciences with a minor degree in English and Anthropology. She worked as a paramedic in the Boston metro area and was a member of the Gulf Disaster Response Team for the aftermath of Hurricane Katrina.
Yes.
Hurricane Katrina. Tell me about that.
Well, it's not really a pretty story. We got the call. I was working in the Boston area. I had just gotten my paramedic license, and the call came for, we need help. We need people. We need ambulances. We need supplies. And I worked for an international company at the time. So they sent us down as volunteers. So we left with a plane ticket and no idea where we were going, where we were staying, how long we'd be there, what the work situation would be like. And initially we were in an office building and they just cleared out a room and threw bunks in there. And eventually, we made it into a place where we could stay. But our first few weeks were pretty intense, really kind of heart-wrenching. Really took a toll on the psyche to really realize what it is to see a natural disaster, to see what happens to homes, what happens to lives. To be driving down the street and see a bathtub in the tree, to see entire houses that have been stacked on top of each other because they were carried by the water.
Wow.
So it was visually very disturbing because nothing looked the way it should. And then, of course, our job when we first got there was to ensure public safety, which was to reduce the contamination in the water that everybody had to get through to travel. So removing bodies from the water was our first job.
Wow.
And so that was how we spent the first part of our weeks. And then as time drifted on, we ended up spending very more succinctly cut hours. So instead of working kind of all day as we were needed and then sleeping when we could, we went on to 12-hour shifts. So for a couple months, it was 12 on, 12 off. And we would go out there and do everything that was needed. So we were all medical response. So we didn't have any trauma centers open at the time.
Really?
So at the level where we were in Gulfport, there was nothing. So even the level 1 trauma centers had been reduced to what we would call a Band-Aid station. They had rudimentary supplies, very little staffing. People were looking for their families. They were busy. They were gone. So there were some buildings. There were still some places we could put people, but we didn't have the staff there to care for people. So we did a lot of long distance transports, a lot of helicopter transports, air transport to bigger towns that still had standing facilities with staff.
Wow, it sounds like a war zone.
It very much was. It was under military rule, so under martial law. So there were times where we would be escorted away from our duties because the scene was considered unsafe by the police there, by the police presence. So primary rules came through the officers rather than our training. So rather than doing what we knew was best for the patient always in the first step, we had to make sure that our safety was guaranteed by the people who were responsible for it before we could do much else. So it was interesting to not be able to respond in the way you're trained, to not be able to give the care that you knew was needed because it wasn't approved of by somebody who didn't have the training, but was there for your safety.
Right.
So
they had to balance that, your safety, the paramedic safety versus the needs of the patient.
Right. So we would be, you could be watching a situation unfold and not be able to interject or help because the police hadn't cleared the scene yet.
Wow. So through all of that, you saw a lot of horrific things, but you must have also seen a lot of beautiful things where you were able to touch a lot of lives and help a lot of people.
Towards the end, it started to feel that way. In the very beginning, it was just devastation. There was no feeling good about the work you were doing. Wow. It was just too much and too hard. And I don't think the human brain is really made for that. So.
And how long did you stay there for?
About 3 months.
And you're pretty much on every day for 3 months. That must have felt like a lifetime.
It didn't, though, because it was so surreal.
Yeah.
Because there was so much work and so much need, and every day you were scrambling for supplies. Every day you were kind of fighting to get what you could to get out into the world to help people, to stock your ambulance, to make sure, So you'd get up in the morning. I had a 4 a.m. to 4 p.m. shift. Mm-hmm. So I'd get up at 3 o'clock in the morning and I'd go check the ambulances coming in to see what I could take to make sure myself was situated to go. And, they would hand us our narcotics in a little fanny pack, and we had to keep them on our body at all times because of the looting, because people were stealing and holding up individuals who were in our position. So that was a lot of the reason for police escorts everywhere we went.
Obviously for your safety.
Because they knew we had drugs.
Right.
And when people are desperate.
Sure. So you go through this, through helping the disaster relief in Katrina, and you come out the other side and you want to become a naturopathic physician.
I think my journey to becoming a naturopath began before then. I had been lucky enough to have some really well-rounded folks in my life all along. And so I'd had people who'd introduced me to Reiki and energy medicine and different botanicals. I'd learned a little about homeopathy through these people. And by the time I was back from Katrina, I still had some fire. I still had some idea that I could go and be a trauma surgeon and be satisfied. But having seen what I saw, having been more intimately involved in lives during that time, to come back and only be a mode of transport, to be just the person who's there for the emergency but not get to see how life unfolded afterwards, wasn't enough. It didn't feel satisfying. And so at that time I had planned to become a trauma surgeon, and that's where my undergraduate focus and everything was. And I just thought that I didn't want to be the person somebody saw once a year to check in. I wanted to be somebody who could be on the ground and helping hands-on. And so I had my own emotional issues after Katrina. I was having some trouble sleeping and some other things going on. I had no appetite. So I went and saw an acupuncturist who happened to have graduated from Bastyr and educated me a little bit on what the naturopathic degree offered and how I would be able to make an impact with that degree. And from there, it was a very short period of time before I was enrolled.
Oh, fantastic. Well, so this brings me to my question about, we know medical doctors. Everyone knows about MDs, right? And in TV, we see these shows like Scrubs and ER and Grey's Anatomy. So we get to, in the mainstream, see sort of behind the curtain what it looks like to be a medical doctor. But there aren't any glamorous shows about what it's like to be a naturopath, to be a naturopathic physician. And so pull the curtain back for our listeners and tell us, what was it like going through Bastyr University to become a naturopathic physician and your residency?
Well, at first it was culture shock to me. It was not what I thought I was there for. I knew that I wanted to attend medical school, and I had a certain expectation of what that meant. And it was very much gleaned from shows that I'd seen and what I'd witnessed in my life. And to be put in an environment where my thought process was challenged, how I believed the world worked was challenged, so it was very interesting. I'd always been very competitive in schools. I graduated with honors undergrad, very academically motivated, to suddenly be in a place where there was no class ranking. There was no first in the class, last in the class. Everything was pass fail, and pass was 85%,
Right.
But they took away all the things that made school kind of unhealthy, and they introduced things that just were beyond my concept of health at the time. So we had to learn how to breathe, and our cafeteria served organic, all natural food, and at the time it was vegan or vegetarian. So now they serve meat and everything else. But it changed my idea of what health was, because my version of it was from an emergency room where doctors and nurses have 5 minutes on their feet to eat, and nobody pays attention to their own needs, and you hold your pee for 6 hours while you take care of your patients. And then to be part of an education system that said, actually, you need to be healthy first before you can do anything to help anybody else. It was very interesting for me. So after that, it's very much academically like any other medical school. It's very rigorous. The science load is intense. It's tremendous. You're taking some quarters, 19 credits, 20 credits, 30 credits towards the end when you're trying to pile everything in and get all of your work accomplished. So as far as what people understand medical school is, it's very much the idea that you've seen on TV, except there's a lot more common interest and community and people working together to help each other succeed, which was the big difference for me, which really let me know I was on the right path, because that's what I wanted to be a part of, with a team approach to health. Residency was actually not a great experience for me, because I took the opportunity to leave the state. I went out to Hawaii, and the gentleman that I worked for was not as scrupulous or ethical as I wanted to be. And so I couldn't agree with some of his business practices. And in a very short time, rather than being in a position of resident, he left the state and left me in charge of the clinic, hiring, firing, front office, ordering everything. And as a new grad, that was not where I wanted to be.
Right. You wanted to have a mentor.
I wanted to have some experience before I had to run a business. Like, the business aspect wasn't even interesting to me at that point. And that's where I had to spend the majority of my focus. So we parted ways, and then I was able to find a midwife naturopath who was willing to work with me, take me on as her assistant, and brought me into a whole new world of naturopathic medicine, doing home births and getting to do more early life care, pediatrics, and women's health.
Fun. So that sort of turned out for you in the end. You got to meet the right mentor.
Absolutely. And that was where I wanted to be. So I got to get to Hawaii, which was my dream. I needed to have some sunshine in my life after medical school in Seattle, and not enough sunshine.
Get some vitamin D.
Right. So
nice.
Went out that way, and maybe it wasn't the ideal situation that landed me there, but the reason I got to stay there was because I found some really amazing people who were willing to take me on their journey and train me.
Awesome. Well, and then you were just persistent to find that mentor and keep on that path.
And just listening, because there were people around me telling me about the people I needed to meet.
Yeah.
It was coming from patients. It was coming from other doctors. And then I came back to Seattle to watch a Bastyr graduation of one of my friends, and another colleague said, hey, there's this doctor you should meet. And finally I listened and made the phone calls.
That is a lesson I think our listeners either they've heard before, or maybe this is the first time they've heard it, but to listen to people and listen to your intuition, because the universe has a way of setting us on the right path, the path that we want to be on. We just have to listen for those whispers. And so sometimes it comes in the form of a friend suggesting it's something, or a podcast, or maybe your gut is just telling you to go in a certain direction. So, listen to that intuition, and listen to the universe when you have a path.
Absolutely. And I mean, there's a common saying amongst most of the people I know where you're listening for the whisper so you don't get the cosmic 2x4, where life will set you up to succeed. You will get warning signs. Your body doesn't just shut down and fail on you. You get a headache, you have sniffles, you have GI upset. Something happens low down on the radar that gives you a warning sign that lets you know, hey, I got to pay attention here. And if I could figure that out for other people in their life with medicine, it seemed ridiculous to not listen to that in the greater aspect of my life as it was showing up.
Right. Well, and this is my biggest, I guess, frustration with allopathic medicine, otherwise known as, what MDs practice, the mainstream MD is. You go there, you might say I have a headache, and they write you a prescription. And you go there and you say, I have muscle cramps, and they write you another prescription. And you go there and you say, I can't sleep at night, and they write you another prescription. And you're telling them all these symptoms. Your body's talking to you in symptoms, and the MD is just trained in drugs. They're not trained in, well, what's the root cause? Well, let's go deeper. Maybe these symptoms are all related. Maybe
you're talking about the major tenet of naturopathic medicine right now. So you're talking about the whole point of what we do, which is to find the cause. Mm-hmm. Treat the whole person, but we have to get in there and understand why the body reacts the way it does. There's a very natural inherent wisdom to everything on this earth, whether it's plants or trees or people. And so if we pay attention, instead of going, oh, let me give you an antihistamine for that runny nose, we say, well, why is your nose running? Do you have nasal polyps? Do you have an allergy? Are you sticking things up there? What's the reason that it's irritated? And when you apply it simply to a runny nose, people go, well, of course, that makes sense. Yes, we should take care of your allergies first. But when it gets into more in-depth problems or things people have lived with for a longer period of time, they don't necessarily see the quick fix that way. They don't see how the root of the problem is necessarily going to help them solve the symptom issue that they have.
Right.
So natural medicine, I think, can take a little bit more patience and a little bit more trust in the body. And hopefully you're working with a practitioner who helps you learn to trust yourself more, so you are listening when you get the whisper and the knock on the door.
Right. And that brings me to my next question, which is, our listeners are professionals on the go. They want to know what they can do to achieve health and stay on top of their game. What do you do to stay mentally, physically, and spiritually and energetically on top of your game?
And that's a big picture, and it changes a lot. The 4 agreements, Don Miguel Ruiz, the 4 agreements. He talks about doing your best every day, and your best every day will be different. And so on my very best days, when I am able to take care of myself 100%, I get up early, I have sunrise meditation with, candles as we let the sun enter our house. It's east facing. And I have downtime before I prepare my food, and I'm able to spend some time with my husband and reconnect before we start our day. Throughout the day, I work on maintaining healthier foods. So I go for a more whole food, plant-based diet, but that's what works for me. It doesn't always work for everybody. I make sure I drink plenty of water. The biggest things really are adequate sleep, good fuel, and asking for the love and attention I need. I find a lot of times people aren't aware of themselves enough, or they're just too scared to ask for a hug or some time to be listened to be heard. And so, as a naturopath, I have a unique opportunity because I'm often afforded more time with my patients, so I get to listen more. But that in turn led me to realize that I needed to be listened to. So that's kind of what I do. I try to make sure that I am meeting my own needs physically, which are for sleep and water and food. And then emotionally, it's about making sure that I take the time every day to reconnect and reinvest in the people who help me get through, help me get by, and make my life joyful.
That's beautiful, and we should all do that. We're going to follow your lead, Dr. Heidi. Awesome. Well, I want to ask you to throw down the gauntlet for our listeners. What's a challenge? What's something that you could challenge our listeners to do right now and for the next 7 days to improve their health? In addition to what you already said, which is sleep, water, good fuel, and reconnecting with loved ones.
There's the basics that are going to help anybody. But I think if you're truly on the path to embodying health, if you want to make yourself feel better, the first thing you need to do is learn to be honest with yourself. And if you could practice for 1 week, not telling yourself a single lie, and that means I'll go to the gym later. If I feel well enough, I'll get that done. Oh, I'll make time at the end of the day. All those things that we just tell ourselves so that we feel better about the decision we're making. I'm just going to have this second cup of coffee today because I'm tired. I'm just going to have this candy bar just this once because I need the sugar. So we tell ourselves these little fibs, little white lies to make ourselves feel better about how we're actually living. And I think the one thing that you can do to help jumpstart any health journey is to spend a week getting to know the stories that you tell yourself. So that way, when you come to somebody like me, I can help you because I'll understand more about your motivation, about why it's important to you to attain health. And that's not usually because, you want to look good for your bikini. You want your husband to be happy. It's usually because you dropped the remote behind the couch, and when you leaned over to get it, your fat roll got in the way. It's something embarrassing and personal. Mm-hmm. And so if we're really honest with ourselves about the little things, about the reasons that we do and say and behave the way we do, then there's room for us to make change. But when we're not honest about our motivations or about where we truly are in a process, there's no way anybody on the outside can help us or guide us.
That is brilliantly said. Okay, listeners, the gauntlet has been thrown by Dr. Heidi. We're taking a vow for the next 7 days to be honest with ourselves. And I really appreciate that. I'm going to do it. I'm going to personally do it because I think you just called me out on everything, everything I do every day. That's great. Oh yeah, I'll go to bed just after this last show. Mm-hmm. I think Hulu has robbed 100 hours of sleep from me.
I just need to read one more page.
Yeah, just one more chapter. That's so true. So I have one last question. You're on a deserted island. It's tropical. Okay. And you can only bring 3 things with you from a supplement store.
Okay.
What would they be and why?
All right. On a tropical island, 3 things. I think I would probably have to bring a good-sized container of Everclear, and that's not to drink, but because alcohol is used in making most medicinal tinctures.
Oh.
And if I were on an island, I would assume that I would have to learn how to survive on that island, and being able to make medicine would be helpful. So I could also use that to disinfect any wounds because I'm very clumsy. So
we got to build your shelter.
Right.
You got to go hunt and gather.
I don't think I can get a machete at the supplement store. So that aside, I would probably want some aloe, fresh aloe, because it's good for, skin protection, and also because it's good for maintaining hydration and keeping your insides kind of soft and smooth instead of rough and irritated. And I imagine if I were on a deserted island, I'd be eating things I wasn't used to. So I'd want something to help my guts stay healthy. And well, I'm just going to hope that they have it at this supplement store, but the water pen, so the personal water purifier.
Right.
Because I know I'm going to need water to survive, so I need a way to make it healthy for me.
This is a very well-stocked supplement store, by the way.
Okay, good.
So you've got those 3 items.
Great. So then I think I can make it, as long as the machete's somewhere.
Well, thank you so much, Dr. Heidi. It's been an absolute pleasure to have you on the show. I really look forward to having you back. I've got a lot more questions for you. I know our listeners are very excited to learn more from you. You are absolutely fascinating to listen to. So
thank you very much.
Yeah, thank you so much.
I was glad to be here. Thanks. Look forward to it.
Looking for even more ways to feel and look healthy? Come to LearnTrueHealth.com and get our free healthy cookbook. There are some delicious recipes and they're super healthy for you. All you have to do is visit LearnTrueHealth.com.